Hey everybody, Dr. Eric Balkavich here. We're talking about labs, and more specifically, we're talking about optimal ranges. You're going to hear a lot of people in functional medicine talk about optimal ranges, kind of giving the allopathic community a hard time because their lab ranges are too wide, and they miss a lot of people with chronic signs and symptoms because they wait to do any intervention. So let me explain this a little bit. When you get lab testing done, there's a lab report you're going to get, and on there's a lab reference range. How is that lab reference range established? Some of those lab reference range are determined by clinical research. Some are determined by the help of companies that profit from by producing medications that suppress certain values within a certain range. But generally, a lot of these lab values are based on the population base that's getting labs tested. So we look at the whole population getting tested for, let's say, LabCorp or Quest. We want to see 95% of the population fall within that lab reference range, and anybody who's outside that 95% is considered the people that might need intervention. They may need a drug, they may need a surgery, but they need some type of intervention because there might be some type of disease or pathology that requires treatment. In functional medicine, you'll hear two terms: the optimal range or the functional range. And this is a narrower reference range. It's usually about a half to one standard deviation away from the midline. It encompasses a much smaller population. It's generally considered the healthier the population, the closer we are to the midline, okay? And so the medical community doesn't really worry about that group. If you're in that lab reference range that they use, they really don't often provide treatments, especially when it comes to thyroid physiology. Why? Because they understand that lab values can fluctuate, and not every time that a lab value goes above a set lab reference range doesn't mean we need medical intervention, okay? So if we look at TSH as an example, the typical lab reference range is 0.5 to 4.5. Now, in functional medicine, you'll hear a lot of people talk about 1.0 to 2.0 is the optimal range. And I would say that if somebody was optimally healthy, right? No signs and symptoms, they feel fantastic, they feel great, their TSH might fall into that reference range of 1.0 to 2.0. But just because it's above that reference range, 2.5, 2.6, 3, doesn't necessarily mean that the person needs medical intervention. Just because it's outside that optimal range. It could be outside that optimal range because it's something, the workout somebody did yesterday, what they ate yesterday, what's going on in their lifestyle at that moment. But if it's chronically outside that range at 3, 4, but still within the lab reference range, and they're symptomatic, it still doesn't necessarily mean we need to give them thyroid medication. It may mean that this is the perfect candidate for functional medicine, so we can help them figure out why TSH is elevated, not just give them T4, not just give them T3 or a combination T4 to T3 to suppress it, okay? So in this situation, I'm gonna kind of go through a couple sets of labs. Here's a TSH at 1.5, which somebody maybe in the functional medicine community might consider optimal. And so if we just stop there, this is a person who has a TSH 1.5, they may not feel fantastic, and we might say, but TSH is good, so there's no intervention necessary. But TSH is, even though it's optimal, in the optimal range 1.5, we take a look at the rest of the panel. The person's free T4 is 1.5. Somebody might consider that's in the optimal range as well. But if we look at free T3, that is below the optimal range, and it's below the lab reference range. So this is a person who's probably struggling with chronic signs and symptoms, but their TSH is 1.5. So if 1.5, if we're going to use this range, that TSH needs to be within 1.0 to 2.0 to be optimal, and here we see a situation where TSH is in that optimal range, but the rest of the labs tell us that the person's not converting T4 to T3 appropriately, then is TSH even though it's in the optimal range, does that optimal range always mean that somebody's is in optimal health? And the obvious answer in this situation is no, it doesn't. So here's another situation, TSH 1.5, free T4 1.4, looks good so far. Free T3 is 2.8. Now in the functional community, we would say that that is maybe functionally low. In the allopathic community, they would, if they're measuring T3 free T3 at all, they would say that's fine because the lab low would be closer to 2.0. If we look at the rest of the panel, total T4 is 8.0, total T3 is 100, reverse T3 is 14. Realistically, this panel does not look that bad. Somebody might say, okay, this isn't too bad, but it could represent somebody who is not feeling good. They have hypothyroid signs and symptoms. Some people in the functional medicine community would say, well, that's because free T3 is too low. We need to give you T3. I would look at this and say the free T3 to free T4 ratio is lab low, so something's reducing the conversion of T4 to T3. So this isn't a situation where we need to give T3 and create some temporary improvement in symptoms. What we need to do is figure out what's preventing the body from converting that T4 to T3. But here's another situation where TSH is in the optimal range, but the person is not optimal. They are not converting T4 to T3 optimally at the tissue level, because that ratio should be closer to 0.31 to 0.34. So this is a person, even though they have a TSH in the optimal range, isn't optimized by what some people would say in functional medicine. So what are we trying to establish here? Are we trying to just treat a number? No, I don't think so. We're trying to address a patient. So here's a second situation where even though TSH is in the optimal range, it doesn't mean this person's not in optimal health, okay? So optimal isn't always optimal. If we look at this last example, TSH is 5.5, free T3 is 1.3, free T4 is 1.3, free T3 is 2.3. This is functionally low, this is lab high, total T4 is normal at 8.0, total T3 is lab low at 71, reverse T3 is elevated 24.3. This is a situation where the TSH is lab high, but the reason I put this in is that an abnormal value? Is it appropriate? Well, the value is abnormal. It is high. Is it appropriate? And the answer is it is appropriate. This is a person who's not converting T4 to T3 very well. They're favoring the conversion of T4 to reverse T3. So there's some type of immune inflammatory process that's adaptively decreasing the conversion of T4 to T3. So even though this value is abnormal at 5.5 and free T3 and total T3 are low, this is an adaptive response to something. This doesn't necessarily mean we need to medicate this person. T4 would not be a great situation. So this is a situation where your allopathic physician might say, your TSH is 5.5, but your free T3 is 1.3. I know you feel hypothyroid, you feel symptomatic, but they're not going to give you medication. In functional medicine, a functional or integrated practitioner might say, oh my gosh, your free T3 is low and your total T3 is low. And they'd be correct in saying that, but giving somebody T4 in this situation or T3 in this situation probably wouldn't be beneficial. The person has enough T4 in the system, their body's adaptively not converting it to T3. And if the body adaptively does not want to convert that T4 to T3, why would we think forcing more T3 into the system is an appropriate solution? So what do I want to kind of wrap this up with? When we look at labs, the more complete the lab panel, the more value the lab testing gives us. If you just run one or two tests in isolation, it doesn't do us a lot of good because it doesn't provide context. So labs are just tell part of the story, and then labs need to be interpreted, not just read for high or low. Is it in the lab range? Is it in the optimal range? We need to interpret them. How do we interpret them? We look at your signs and symptoms. We look at your thyroid panel. We look at the rest of your lab panels, and it doesn't matter if it's thyroid panel or blood sugar markers, whatever. The more context, the more labs you have, and then we look at signs and symptoms as well. That's how we interpret labs. And when we look at the options, we can have a lab value that's optimal and appropriate. We can have a lab value that's optimal and inappropriate, which happens quite a bit. We can have a lab value that's abnormal and appropriate, and we can have a lab value that's abnormal and inappropriate. But this is where interpretation comes into play, and keep in mind that context matters. What are your signs and symptoms? What do the rest of the labs tell us? We can't look at one lab value in isolation and make a really good decision on is a lab value normal and appropriate, normal and inappropriate, abnormal and appropriate, or abnormal and inappropriate. So if you have any questions, put them below wherever you watch the video. Thanks.